Hi, everybody. This is Mark Ittleman, the speech pathologist who can make a rock talk, and welcome to this edition of a conversation we're having with caregivers. You know that my book, The Teaching of Talking, was designed for the caregiver in order to give them a method to help stimulate speech and language at home. And I have here Donna Davidson, who has become a very good friend of mine, and she has a story to tell about caregiving and the experience of the personal experience of having her husband who had a stroke. And so I'm going to now introduce you to Donna and let her tell you her story.
Hi, Mark. It's nice to be here with you. I just want to let you guys know about my story, and I hope that something I can say might help you in what you're going through with your loved one. My husband, Larry, was 59 years old, a very brilliant man. He loved to talk. He loved to share funny stories. He was always the life of the party, and he also talked for a living. He was a industrial training instructor, and so talking was a huge part of his life. And anyway, there were a few signs that happened before he had the stroke that I wanted to share with you guys, just so you could watch out in case any of these things happen to you, or you could warn others about it. Larry had started having problems seeing out of his right eye, and he confessed that to a friend of his. He didn't tell me. He didn't want to worry me about it, but he told one of his really good friends that he was having trouble seeing out of his right eye, and had his friend look in the eye, and he said it looked fine. And then he confessed that he had stopped taking his blood pressure medication and his cholesterol medication. So his friend encouraged him to start taking his blood pressure medicine again. He thought that might be something that was causing the problem with the eye. And he said Larry took his blood pressure medication, and in about 15 minutes he started to be able to see out of the eye again. Anyway, he didn't mention that to me or tell me about it. Otherwise, I would have had him at the hospital right away, probably. But anyway, so that was one of the things that happened to him. One thing I did know about, because I was there when he experienced it, is he had been having some vertigo and dizziness problems, and that I did witness. And I actually did tell him to set up an appointment with the doctor. Well, I made the appointment myself. I didn't leave it up to him to do. So I made the appointment with his doctor to go see why he was having vertigo problems. And I didn't know about it at the time that he had stopped taking his medication and all that, but he had recently lost weight, and he'd lost about 50 pounds and had been going to the gym with me, which was something I had begged him to do for a really long time. So I was very excited that he was doing that, but because that he was feeling better and had lost some weight, he didn't think he needed to take his medication anymore. And you should never, ever stop taking medication without consulting with your doctor first. So that's something that if I'd known about, of course, I would have started making him take his medication if I'd known about that. But anyway, so we did have some warning signs, Mark, that I wanted to make sure I could tell people about in case they experienced anything similar. Right before Larry had the stroke, he had a terrible, terrible headache. And he had picked me up from work. I'm a flight attendant. I'd just come in from Amsterdam, and actually I had the flu, and he was going to take me by Walgreens so that I could see a physician there. And while we were there, he had this huge headache and actually had the stroke right in front of me. So I saw his face fell on one side, drooped the eye and the mouth and everything drooped, and then I asked him to tell me your name, and he just was very, slurring in his speech. He said, my name is Larry Davidson, and I knew immediately he was having a stroke, and I yelled for someone to come and help him. So that's how this all started, Mark, and that was in December 2010, and boy, that changed our lives that day. Anyway, they came, and ambulance came right away and took him to the hospital, and he was put in the ICU, and his brain started to swell a couple of days after he was there, and they had to remove the left side of his skull to allow the brain to swell. And so anyway, so that was a 2-week stay at the in the ICU there. Then they decided that the brain damage had been so bad that they needed to take him to a famous, reputable, acute. Help me out, Mark. It's called the acute
Rehab
phase
center.
of. Yes, thank you very much. It was an acute rehab hospital. Thank you. And actually, Larry was a resident there for about 3 months, and that's when they immediately started helping him with his therapies there. And that was speech therapy, of course, because he developed aphasia, which I had never heard of before until my husband had the stroke. But he had developed aphasia and wasn't able to speak in any way understandable at all. Anyway, so they started him on his speech therapy, and also he had to have physical therapy and occupational therapy as well, because he was unable to move the right side of his body. He had a left brain stroke. So anyway, he immediately went into this rehab. Every day was out, about 8 hours of rehab therapy that he was doing, and he seemed to be an excellent physical therapist and occupational therapist. And then the speech therapist that he was assigned, she seemed to me to be very, very new at her job, really sweet girl. She was doing the best she knew how to do, but it seemed like it was kind of a new thing for her. She was a new therapist, and I didn't know at the time that Larry's stroke was as major as it turned out that it was, and that the aphasia was going to be such a huge thing in his life. Or if I'd have known then what I know now, I would have gone in and asked for someone that was more experienced in speech therapy, because that was something that Larry really had a need for, it turns out. Since I had never known anyone that had speech therapy, or even known anyone that had a massive stroke, I was just brand new and just, I took that they all knew what they were doing, and so I just went along with whatever that they recommended. And I wish I had known, like I said, I wish I had gone in and asked for someone that was a little bit more experienced so that they could help Larry to regain his speech. If I had known where you were at the time, Mark, I would have asked for you. But unfortunately, I didn't hear about you until almost 2 years after Larry had his stroke. But anyway, so he got therapy right away, but I think looking back on it, it could have been more, and it could have been better. And one of the things that I remember looking back on it now is that I wasn't really taught as a caregiver how to help Larry stimulate speech or any of those kind of things. He just went to his therapy sessions, and in fact, she even asked me, she said it might be better if I were to leave the room. I was with him during all of his physical therapies and all of his occupational therapies, and they welcomed me to be a part of that. But with the speech therapy, she thought it might be best if I didn't stay in the room, because she thought he might be uncomfortable trying to talk with me there. And Larry was a proud man, as most men are, and she was afraid that he wouldn't try to talk in front of me, being embarrassed that he might not be able to say things the way that he wanted to. So I said, fine, that sounds good to me. So I would leave him in there alone with her. And during those early months, he was there for 3 months. And during that time, they told me later that the patient isn't even aware of how bad that they are in the beginning. So he almost had like a sense of euphoria during those 3 months that he was at this hospital. And he was happy all the time. And I asked him later if he thought he was saying what he was intending to say, and he said yes. He wondered why everybody had such a hard time understanding what he was saying, but Larry's aphasia was really bad, and he most of what he was saying wasn't even words. Every now and then he'd come out with a real word, but it was mostly just, wasn't even real words. But he thought he was speaking normally and wondered why we were all having such a hard time understanding what he was trying to tell us. So anyway, when I finally found out that he thought he was saying the words that he meant to say, then that helped to understand a little bit better. But he also wasn't very upset about the fact that he couldn't talk because he didn't know he couldn't talk during that time. And after he left there, they told me and him at the hospital that he would need to go to a second post-acute rehab facility, inpatient. And I believe that's when Larry's depression started to set in at that point. He thought that if he worked really hard and did everything they asked him to do, that he'd get to come home and just go back to normal life, and that just never did happen. So we were sent to this second rehab hospital that was more, their emphasis was more on Larry becoming more independent. And so part of that meant that I had been with him every day almost for about 3 months. And this new place, they said that now it's time for him to become more independent. And so they asked me not to come during the week, that I could only come and visit on the weekend. So Larry went from having me with him every day almost, except when I had to work, and I would only work 1 3-day trip a month. But anyway, he was used to having me there with him, and then all of a sudden I'm not allowed to even be there with him, and he went into a deep, dark depression at that point. Plus they explained to me that his brain was beginning to heal, so he was actually more aware that he wasn't speaking properly, and he was much more aware of his deficits at that point. And they told me it was common that depression would be, that was just a common effect of the stroke and of the aphasia. So I would leave him there during the week, and I'd come and visit every weekend, and it was just very sad to see how depressed that he was at that point. And they all assured me that that was normal. Well, I don't care if it was normal. It was still very painful to see him in that kind of condition. And he had been such a fun and positive person that it was really difficult to see him being, just so depressed and so down and all of that. So that was a really tough time for us. And he was there for 2 months, and a lot of good things happened to him while he was there. He actually relearned how to walk while he was at that facility, and they did a lot of good things for him, but the speech was still very, very slow in coming, and that was the one thing that Larry wanted to be able to do, was to communicate. He had told me once that, he talked about Stephen Hawking in that wheelchair and not able to move or anything, but he said I could do that as long as I was able to think and to communicate my thoughts. I would be fine. So Larry was regaining the use of his arms and his legs, but the speech just wasn't coming along like we had hoped. And so anyway, the insurance said that it was time to go. You know how that is, Mark. They do that. And so they told us that it was time to leave. And so they discharged him, and I felt just so I was not equipped to bring my husband home at that point, I felt. And it was a scary time. I was glad he was coming home, and it was more than 5 months since he had the stroke before he got to come back home. So that was a long time being in an inpatient at these hospitals. Anyway, so he comes home, and we tried to get back into what was going to be our new normal life. And part of that was, though, going to outpatient therapy. So we found a place that we could take him about 3 days a week is what we went. And he got the occupational therapy, the physical therapy, and the speech therapy once again. And the speech therapist also told me that it was best that I not be there, so I didn't go to his meetings. But sometimes when I come to pick him up, I know I told you this, Mark, that I would come to pick him up sometimes at the end of his speech therapy, and I stand outside the door and I could hear him crying and just so frustrated that he couldn't do what it was she was asking for him to do. And that would break my heart, of course. Oh, goodness. So anyway, She would send him home with homework, and he'd have these papers that he was supposed to fill out, and fill in the blank or circle the correct answer and that sort of thing. And because of his brain damage, he had a really hard time completing that work, and he would sit there sometimes for hours working on these papers, trying to fill them out. And I asked her, I was like, can I help him? And she said it's really best that he do it on his own. And so you can imagine the frustration that I would feel, and of course that he was feeling was just intense frustration, not being able to do the homework, that she had given him. And anyway, so we did that till once again the insurance said it was time to stop the outpatient therapy, and basically the physical therapist and the occupational therapist.
Now wait a minute. Hold on a minute, Donna. Hold on a minute. We can't leave it like this right now. What kind of training did you get from the therapist? Did the therapist spend time with you and teach you how to stimulate his speech, or what's with the papers?
No. Yeah, no, I wasn't given any sort of training as to how I could help him at all. I just thought my job was to just, take care of his, just take care of him, make sure he had something to eat and drink. Nobody told me that I could help his speech until, like I said, until I had read your book, I didn't know there was such a thing as me being able to stimulate his speech. I mean, I would ask him questions and I'd have him point at whatever it was that he wanted. I never even thought about asking him to try to say the words, because I didn't know I was supposed to do that, or that was even an option. And so no, I was given no training as a caregiver how to help him with a speech therapist, because I was leaving it to the professionals that got paid to do that. So yeah, I didn't know that I could even do that. So yeah, the homework was I just shudder when I think about the homework, because it was just such an awful thing. 3 times a week that he would come home and try to work on his homework, and it was stuff that he could not do. He just wasn't able to do that. And I remember you talking about people with a speech problem. They want to talk. They don't want to write or circle the right answers or any of these things. He didn't need to do that. He needed to be able to communicate. And those papers, I mean, maybe they work for some people, but they did not work for my husband. It caused him a level of frustration that would end in tears every time he tried.
Can you say that again, Donna, please?
Oh, sure. The homework that she gave him ended in such frustration that he would cry, and he thought he should be able to do this homework, but he was not able to do it. And he was extremely frustrated, and he hated going to speech therapy because he never had any success, it didn't seem like. And then she just told me, eventually she told me that Larry had reached his potential, that there was no more that he would be able to do. And
did he have any speaking homework or anything that he was required to say or practice saying? Did you ever hear them work on speech or work on vowel sounds or work on words? Or?
Well, since I wasn't allowed to go to the actual therapy sessions, I really don't know. I'm sure they probably did do that during the session, but they sent him home with just paperwork, not speech work. And so I didn't have anything that I was supposed to. I started looking for other things myself, just because I was trying to be proactive in helping him to recover. But I found these DVDs online that it would show a picture of a cup, and then it would repeat cup, and he was supposed to say cup. And just think, I bought videos, I did things, I tried everything I could to go outside of what we were getting from the insurance, and I paid money, I paid a lot of money to try to get him help outside of the insurance, because that didn't seem to be going very well. And when she said that he had reached his full potential, that just made me so upset to hear that. But I didn't know if it was true or if it wasn't true. I really didn't know. And then I found your book, Mark. I was telling you about just, searching on YouTube or Google or whatever. I was always looking for any any new therapy that I could find or whatever to get Larry involved in, because I wasn't really willing to take that as an answer that he had reached his potential. I just could not accept that. So I started looking for other ways of helping him. And I saw your website and heard about your book, and I ordered your book, The Teaching of Talking, because I was like, wow, there is something that I can do personally to help my husband to stimulate his speech. And I read your book, and I was so very excited about it. I was really looking forward to trying this therapy with my husband. And I don't know at what point I should tell you the very sad end of the story, but I need to let people know that in my husband's case, it did not end well. His depression and his lack of being able to communicate, he actually took his own life because he didn't get the help that he needed so badly and so desperately. And that was the end result for my husband. But I'm trying to let people know what happened to us in hopes that it can help someone else and prevent it from happening to someone else, you know. So anyway, I was just very excited about your book and was hoping that we would have a chance to learn, you know, to do that new therapy. And I just had gotten the book not too long before my husband committed suicide, and I never did get to try the therapies with him. We did do the very beginning of the book. I made sure that he was a candidate for doing that therapy, because you had those tests in the front of the book that to see if your loved one is a candidate for that type of therapy. And he actually did. He was able to do it, and I was so excited about that. And anyway, he wasn't able to stick around long enough to see if that therapy would have helped him. He was so discouraged about all the other therapies that we had that just didn't seem to really help him at all. And I just know that your therapy would have helped him if he could have just stuck with it a little bit longer, Mark. I just know that it would have helped him, and I just hope that your book will help a lot of other people so that their story doesn't end like ours did, you know.
I think it helps us realize that communication for Larry, as well as for many people out there, is such a vital, important aspect of living, and that when, for whatever reason, it doesn't work, or if something happens that speech does not develop, it's devastating, and in this case it was. Now, Donna, we have about 4 or 5 minutes before our interview is up, and what I'd like you to do right now is, if you would, just summarize what you would like to share with other people. Just kind of summarize, if you would, the things that you've learned and the things that you would hope that people have gotten out of this interview that we've had.
Okay. Well, the first thing, like I said, is to know some warning signs if there is a stroke, that perhaps if I had known about the eye, that he couldn't see out of his eye, and we could have gone to the doctor, we could have prevented possibly the whole thing happening. Okay, so that's very, very important. If you have any signs of things, we're having vision problems, dizziness problems, severe headaches, anything that's not normal, please go see your doctor and tell them all about your symptoms, and perhaps they can stop a stroke before it even happens. If it has already happened, there's a lot of things I'd like people to know, and that is that you have to get help immediately, as soon as possible, to get help immediately. So don't just sit at home and have something that you know is wrong with you and just go, well, I'll be okay. No, you go get help. It's always better to be safe than sorry. So please go to the hospital. If you have any symptoms that are not normal, please seek help. And if the worst happens and you have a stroke and you're left with communication problems and you need to have speech therapy, please seek out the best speech therapist that you can to help your loved one to be able to communicate. And don't settle for someone who is inexperienced. Don't settle for not being a part of the therapy. And I know that that's going to rock the boat with a lot of people, because I was told it is best if you're not in there. But here's the thing. You are going to be there with your spouse or your loved one 24 hours a day. The speech therapist is only there for a certain amount of time, and they can only do so much. And if you, as the caregiver, can't take over and be their speech therapist, you're missing out on a lot of hours all day long that you could be helping to stimulate their speech. And that may be the old style of the way of doing things, Mark, but you're trying to promote a new style of doing things, and that is the caregiver is essential in the speech therapy process. And so I would recommend, first thing, that they get your book, The Teaching of Talking, and start to stimulate your loved one's speech and be the advocate that they need, because if they can't speak, they need you to speak for them to get them the best care. And like I said, I'm trying to pass this on, the knowledge that I gained from this, so that people won't have to go through what I did and what my husband did. And so I did the best I knew at the time, of course, and I just trusted that the doctors and everybody knew what they were talking about, and that the speech therapist, knew exactly what was best for Larry. But now I know that the best for Larry would have been if I could have been his speech therapist, along with the speech therapy that he was getting from the professionals. It's very important to have a professional being your speech therapist, your therapist. So I'm not saying that. It's extremely important that you have someone who is very knowledgeable and that knows what they're doing. And then you can also stimulate your loved one's speech at home with everyday activities. What would you like to drink? Do you want tea or do you want water? Do you want to wear the red shirt or the blue shirt? And I just had him pointing at everything. And they should be trying to use the words. And so learn how to be be a caregiver that is an advocate for your family member and your loved one. And don't take no for an answer when they don't want you to be in the room. Don't go to a therapist that won't let you be in the room, first of all. And because you are an essential part of your loved one getting better. You are essential. So that's what I want to say, Mark, is to make sure that people know that they are crucial in the recovery of their loved one, and that they need to learn to be a speech therapist as well.
Yes, they need to really learn how to stimulate speech and language. And I'm really so glad that you emphasize that, because a lot of times when a speech pathologist says, I think a patient has reached their potential, quite often what the therapist is really saying is, I don't know what else to do, and I've reached my potential. And unfortunately, things like that happen every day. I think I told Donna that, if any of us needed open heart surgery, we wouldn't necessarily go with somebody who was, just very, very new to practicing. We'd probably want to go with someone who had some background and who had some experience. And in these days and times of insurance where they're having caps, you don't want to mess around with people who aren't experienced. So make sure that when you meet a therapist who may be working with you, find out about their background and find out about how long they've been practicing. Find out about their knowledge of aphasia, how long they've been practicing with people who have aphasia, what they know about aphasia, and then make your decision. Unfortunately, in many hospitals and many outpatient clinics, you're just assigned to who's ever available. Not necessarily how good they are or how experienced they are, but just, who's available at the time when you can come in. And that I really have an exception with, and I hope all of you will learn that too. So on that, I would like to say to you, Donna, you're awesome. And I'm sure that some of the other caregivers may like to hear from you again. I mean, you've got such a wonderful presentation and such a wonderful spirit. We can all learn from people who are experienced, and you're experienced, and I'm experienced, and experience is what it takes to help overcome something like this. So on that, I'd like to wish everybody a good day and a good evening, and good health and well-being. And thank you again, Donna, for being with us.
Thank you, Mark.
Okay, bye-bye now.
Bye-bye.